name is Anna Houghton. I'm the owner for Accra Physiotherapy and Sports Injury Clinic. Our clinic was established at the end of 2009, and we've been in operation for the past nearly 10 years. And the premise of the clinic came from my experience outside. I was trained in Britain. I worked in Canada for several years and owned a private clinic there, and felt that we needed an establishment like this in Ghana. So I moved back home and established this clinic. The clinic has a number of physiotherapists. We have 4 full-time staff. We have a psychotherapist, which complements our work with some of our neurological patients. We have massage therapists. We have therapy assistants that work with us. And we refer out for patients that require speech or language or any other health-related rehabilitation needs when we see them at the clinic. I trained initially as indicated in Britain, and I worked in the area of neurology. I worked with pediatrics. I worked with intensive care, and eventually specialized in the area of women's and men's health. I subsequently moved to Canada, and in Canada I worked in the hospital system before setting up the private clinics that I have in Canada. As I mentioned, I specialized in women's health, particularly in women that have had pelvic floor problems, women that have had sexual abuse, women that postpartum or post-delivery have pelvic floor injuries, have damage that occurs, and so they develop problems with the bladder function and with their bowel function. I also deal and specialize specifically with men following prostate surgery, and they tend to have problems with leakage and erectile dysfunction. And so I do work with them with the pelvic floor. I do internal work with them to try and retrain the pelvic floor muscles, and also in retraining the erectile dysfunction, and also in getting them to get control over their bladder function. The clinic sees a variety of patients. We see patients ranging from children, babies, to, of course, our seniors, our 80, 90-year-olds. We see patients that have neurological problems. We see the stroke patients. We also see patients, a lot of our patients are mainly orthopedic based, so a lot of back injuries, a lot of cervical injuries. We see patients after they've had surgery or have had a fracture and required to be rehabilitated so that they can become functional in their daily lifestyles. We see patients who have also had problems with just function, just being able to move with their gait, with their walking, to make them safe and make them independent. We have just added to our staff a physio from Canada who has come with a specialty in vertigo and vestibular rehabilitation. So dealing with patients who have dizziness, who have problems with balance, problems with orientation in space. So it's a very specific area of training and of rehabilitation. So we're hoping that this will open the door for several people with some of those problems. We're also looking at falls prevention. One of the biggest problems with our seniors is that they fall down. Their balance or their sight, their vision, their comfort, and their ability to move from A to B. The lighting may be bad, the step, they might not see it, they have weakness, and so they tend to fall, and when they fall and end up with a fracture, that always complicates their lifestyle. It puts a big burden on the caregivers that look after them, their partners, their children. They may end up in hospital, they may end up with surgery, and then that often is a downward spiral for a lot of these patients. So we're putting a program together that looks at how do we prevent a lot of these patients from falling and improve their ability to function a little bit more independently. So we've got a variety of things that are happening here, and we hope that this whole information will encourage patients to come and see us We are all certified physiotherapists here, and we ensure that we provide the most excellent, efficient, and effective care to our patients. It's client-centered, so it's about the patients, about the client who comes in here, and not about ourselves. Thank you very much.
Hi, so my name is Sarah Abasbe. I'm a physiotherapist working in Ghana. I was trained in Canada where I was born. I came to Ghana and I'm working here at Accra Physiotherapy and Sports Injury Clinic. So what I'm doing here, I'm doing orthopedic neurology rehab as everyone else in the clinic, but I also do and I'm specialized with the vestibular rehab. So vestibular rehabilitation is treatment, so basically it's assessment and evaluation and also treatment of the vestibular system in your ear. It's also evaluation of the central system in the brain and the connection between both, and to improve with different conditions such as BPPV or people who had labyrinthitis and different other conditions. It treats mainly people with dizziness. So I treat dizziness with vestibular rehabilitation, but also people with vestibular migraine, cervicogenic migraine, and different other pathology with the head. So this is one area that we will try and develop more in this clinic. The second thing that we will start to develop and that I'm really looking forward to is fall prevention with elderly. So seniors are at risk of fall, and the fall that they have can lead to really severe consequences. So to prevent falls in seniors with physical activity and also to evaluate, to do a proper assessment of the factors that increase risk is really, really important. So what we are aiming is to develop a program where we can target people who are at risk of fall and then eliminate the different factors and also help them physically to be in a better condition to avoid those falls.
So my name is Ivy. I'm a first year student from European School of Physiotherapy in Amsterdam, and I'm doing my first internship here at the clinic. And it's super nice to be here because everyone is really, really kind, and my CI is following me a lot and is helping me and asking me questions, and I can ask really questions to everyone. And the patients here, there are different kind of patients from neurology to musculo-skeletal, so there's a wide range. And what I could see that is really, really good is that patient that comes in usually goes out with a big smile and just to feel the progress that they achieved during the treatment. And for me, it's being really important to be here, and I feel like it's the best place that I could do my first internship into.